Hello, it's Dr. Rhonda Johnson. Today is Sunday, December 20th, and I'm going to be talking about the COVID-19 vaccine and the history of medical experimentation on humans and the Tuskegee Syphilis study and what all of this historical information has to do with someone's personal decision of whether or not they will take the vaccine or not. So let's start off with the Tuskegee Syphilis study. Well, we remember that this involved 399 black men in Tuskegee, Alabama, who had late stage syphilis. They were followed by the Tuskegee Institute and the local health department. They received medical and nursing treatment for what they thought was bad blood, a local term for sickness. They received placebo treatments, aspirin, tonics, and even burial insurance. They had to agree to autopsies upon death. Their study was coordinated by a African American nurse, Miss Eunice Rivers, who was one of the first African Americans to be employed by the United States Public Health Service. The study was known to the American Medical associations and public health professionals. Ongoing results of this study were published in 9 different journals over the course of the study. That study ended in 1972, was widely reported in 1974 by national newspapers. It is now 48 years later, but the horror and injustice of the Tuskegee Syphilis study remains. The facts that the United States government was a part of it, the fact that the United States Public Health Service lied, coerced, and there was a complete violation of trust between doctors and researchers and even black nurses. This remains in the memories of generations of African Americans, and it should. I'm not suggesting that anybody forget this. And there was more. There were other widely known incidents of medical experimentations on blacks and others. For example, most gynecological surgeries were done on African American enslaved women without anesthesia or their informed consent. Servicemen were given LSD, and there were other mind control experiments done by the CIA. Blacks were tested for radiation experiments for the Cold War and were used to determine radiation doses for cancer treatments at some well-known academic medical centers. Nazi physicians were notorious for their experimentation on Jews during the Holocaust. And there were well-known research experiments on prisoners. We have to acknowledge this. We have to own this history. And yes, it does hurt. It's raw every time we hear about it. It replays into our unconscious minds and to our conscious minds. So I acknowledge all of this history. It is important and it is relevant. But where does it fit in today? So let's fast forward to today and our current situation around this COVID-19 pandemic. First of all, there are numerous requirements and regulations that have to be in place before human subjects can be researched or engage in clinical trials. In fact, after the Tuskegee study, all research receiving support from the federal government in the United States has to meet ethical requirements. That includes institutional review boards. These institutional review boards include scientists across many different disciplines, ethicists, and regular people. Some are independent, some are institutional, some are accredited by government agencies. There's an Office for Human Research Protection within the federal government. And all clinical trials of drugs, vaccines, and devices have to abide by these regulations governing human research here in the United States. Now, folks, I'm not saying that there are no possibilities for ethical compromise. I'm not foolish. Wherever there's a will, there's always a way. But again, it's not like it was before. And that's a good thing. So I want to discuss next some of the differences between the past history of medical research and the COVID situation today. There are some very real differences. The COVID vaccine clinical trials by the pharmaceutical companies that you've heard about on the news, Pfizer, Moderna, AstraZeneca, Johnson & Johnson, GSK, Sanofi, these trials are voluntary. People are not being coerced to participate in these trials. Another important distinction is that people are not being withheld treatment or cure. In the Tuskegee Syphilis study, people were withheld treatment with penicillin. Right now, we have no known treatment or cure for this coronavirus. The next important distinction is syphilis is not COVID. You can live for years with syphilis, folks. For the folks who have died from COVID here in the United States, some 320,000 of them and climbing, it did not take 40 years. It took 9 months. This is a disease that is killing one American every 35 seconds. Around the world, COVID is killing one person every 8 seconds. For African Americans, according to the CDC, the death rate from COVID is 18.2%. This means that already almost 59,000 African Americans have died from COVID. Folks, going forward, as you listen to all the news and the stories, and everybody's got an opinion on this, I know, I suggest you keep in mind one important thing. Your decision to get this vaccine is personal. It's a personal health issue. Many healthcare workers consider this to be a matter of life and death. It is not a political issue. Although I understand the vaccine is politicized, the pandemic has been politicized, the virus is politicized, the economic fallout of the virus is politicized, the mental health crisis is politicized. Everything corona-related has been politicized, and this is very unfortunate. My suggestion to anyone considering whether or not they're going to take this vaccine is to make your decision a personal one. Base it on your medical history, your age, your medical risk factors, and then ask yourself how long you want to live in terms of years of quality life, if it's your choice. Ask yourself about what is your responsibility to your family. Think about all the things that you still want to do and accomplish, your wishes, your desires for your future, and weigh in how that possibility of getting a COVID infection might factor into your vision for your today, tomorrow, and your future. Folks, there will be so many more vaccines coming online in the future. Yes, I realize all of these are investigational. It is just a fact of this pandemic. So keep asking questions, and please stay alive long enough to ask your questions and get your questions answered. Look, if you get sick with this virus, history is not going to help you. Unfortunately, it's going to be a battle between your immune system and this virus. That's it. And your immune system is probably already stressed from 9 months of this pandemic. So folks, try to keep an open mind, continue listening, continue collecting information, and make your decision a personal one. This is Dr. Rhonda Johnson, and my views are my own. Take care, folks, and stay well, and stay prepared, and stay the course, and always have a blessed day.